factors that can influence a person's health. And food insecurity is under economic stability. So basic definition of food insecurity by the USDA. I really want you to look at this part right here, limited or uncertain access to adequate food. And these are certain measures that influence somebody's food insecurity. Poverty and poor market access are probably the biggest contributors, I would say. With Ohio is ranked number 6 in the nation for worst food insecurity rates, and 3rd in families having to skip meals because they don't have the means access to have a meal. So how does food insecurity affect cancer? So as we see, poor diet is one of the risks that we see in increasing cancer risk. So I wanted to see the way food insecurity affects those. I use the CDC's interview survey that basically asks questions, and due to them I was able to have the data to even do this project. The main variable I looked at was food security levels. And you're wondering how they leveled it. With the question they asked people, did you cut meals or skip meals because you didn't have the money to pay for it? Did you lose weight because of food insecurity? And they measured it between food security being the highest level, low food security, and lowest food security. Other variables I looked because I want to see how it affected cancer, how it affected PCA testing, mammogram testing, and the ability race played into these. So these numbers are kind of large, kind of small. So I want you to look like at the bottom number of each column. So here, this is basically, I use SAS analysis that I learned this summer. Actually, it was kind of fun. It was like coding. It was kind of a struggle at first, but getting the hang of it was pretty cool. And I did chi-square tables that's used to show association. So here I looked at all the cancer patients, and I looked to see with cancer patients who are more likely to be food insecure or lowest food insecure. And unfortunately, our black and brown residents, our black and brown cancer patients are more likely to be in food insecure levels. And then even here on the table on the right, you show that in low food secure, black cancer patients were 6 times more likely to be in low food security than white patients. And screening was shown with this. And I just looked at, and then again, I looked at the pool of people who did a PCA test, and I saw the more likely you are to be in worse food security levels, the less likely you are to have a PCA test. And then I looked with black people who did a PCA test compared to the white counterparts, and I saw that you're twice as likely to be in more low food security levels than you are to your white counterparts. And 6 times, yeah. And then I also did the same for mammogram screening, and it showed the same thing, that the lower your food security levels, the less likely you are to have a mammogram testing. And I even did the correlation with race, and it showed the same thing again, that black and brown women were more likely to be in low food secure levels. For the directions, I believe we should do more cancer screening with areas of higher deprivation because they're more prone to be in food deserts, have lower income levels, poor diet, a lack of healthcare access. But I really want to stress that we need to aid cancer patients in food insecure conditions, have more screenings to see with cancer patients if they are in food insecure situations, because those patients are put at a dire risk of having to decide whether to pay for treatment or pay for food. And we're talking about cancer patients as is. Thank you.